Hi, Med Made Easy here. Welcome back. Today our video is going to be on statins. Everything you need to know either for your NCLEX studying or just for general medical knowledge. We've got a few things that we'd like you to know about statins. Tip number 1. They can cause rhabdomyolysis. Rhabdo is the breakdown of muscle tissue. When the muscle tissue is broken down, it releases this protein called myoglobin. The protein myoglobin, it's very hard on the kidneys, so that's why you often see kidney failure along with rhabdo. The main thing, it's important to be able to recognize the signs and symptoms of rhabdo. Certain medications should not be combined with statins. This list here are a few. These will increase the risk for developing rhabdo. Tip number 2. Statins can cause liver enzyme elevation, particularly AST. If you can remember A, alcohol, S, statins, and T, Tylenol, approximately 70% of these elevations usually fall to a normal range once the treatment continues, but it's just important to remember that liver damage, even though it's in a small percentage of people from statins, it can happen. Tip number 3. Myalgias, muscle aches. This is one of the most common complaints that people have as a side effect. One of the things though is you can be on one statin and have these problems, these muscle aches, but then change to a different statin and not have these muscle aches. Tip number 4. Something that a lot of people don't realize is that statins can actually increase your glucose level. This is important to know, especially if you're a diabetic, but it also can affect you even if you're not a diabetic. And the final tip, tip number 5 that you need to know. Cholesterol is usually synthesized when you're not eating, when your intake is the lowest, so in the nighttime. And there's been some studies that have actually shown that this is the best time to take statins, and so that's why it's recommended for most statins to be taken in the nighttime. So now you know, those are your 5 tips. Make sure to subscribe to our channel. Make sure to give a thumbs up to this video to show us that you want us to make more of these NCLEX info tips, and we will see you in the next video.